Sarakham. Good afternoon once again. It's a pleasure to be back in the briefing that we have here at the Center for COVID Situation Administration. Today is Monday, the 7th of February, 2022. Just like to start off with a quick summary of the Thai briefing just now. In particular, points and issues that I believe may be of interest to our English language audience tuning in from in Thailand or around the world on our social media. So let me first start with good news that from Friday afternoon, when Thailand's Food and Drug Administration, or FDA, had approved the use of the Sinovac and Sinopharm vaccines for people 6 years of age and older, thus expanding the vaccine options for our children aged 5 to 11 from previously only Pfizer, using only Pfizer. For the global situation, the number of new COVID cases essentially is down on a downward trend, including Germany, the United States, France, the United Kingdom, and India, with the exception of Russia, that is still slowly rising. In Thailand, more domestically, in the province of Maha Sarakham, recently they found a new cluster with high numbers of high-risk contacts. Therefore, the Provincial Communication Disease Committee had made an announcement seeking cooperation from the residents of the province of Maha Sarakham to refrain from sharing any meal in terms of community dining among the group of people in any gathering activity, including meetings, seminars, religious activities, funerals, weddings, and the rest, effective from the 5th of February, last Saturday, until further notice. And once again, just like to reiterate that prevention measures remain vital and strict surveillance are still very important. We should remain cautious and carry on with practices like wearing masks, staying in well-ventilated spaces, and following universal prevention. Just an update on the arrival of travelers, update on the entry into Thailand. During the 1st to the 6th of February, up until yesterday, we have a total of 30,218 travelers who entered Thailand. And of this number, 7,617 travelers continue to enter via the test and go or quarantine exemption scheme. We have 18,617 entering through the sandbox scheme and 3,987 entering through with quarantine. And out of the total number of travelers, we have 1,081 who tested positive for COVID-19, or 3.58% of all inbound travelers. So the majority of international travelers come from these top 10 countries during the past 6 days, the 1st to the 6th of February. You can see that on screen. The top being from Russia, UK, Germany, France, United States, and the rest, as you see on screen. And before we go on to the next section, I'd just like to remind all travelers to ensure that all related documents used for application for the Thailand Pass for entering Thailand is very important. Now, whether it be the vaccine certificate or the COVID recovery certificate, they must be in the English language or a bilingual document with English being one of the languages. Now, this is for the traveler's own benefit, as a non-English document may result in delays or inconvenience of the processing and, of course, of your travel. Now, more on the Thailand Pass. Just allow me to share with you some information on that, just to provide a general understanding. We have a approval process. It's a two-step approval process. Once you have registered, the SHA Extra Plus Hotel will approve the first step after you have made the payment for the hotel, including RT-PCR test on the 1st and 5th day where applicable. And second step for the Department of Disease Control to verify the vaccine certificate. Then the system will automatically send the Thailand Pass QR code to the applicant. Now, if you have any inquiries regarding Thailand Pass, we have contact numbers and email provided. It's coming up on screen for you. Yes, the 30 line, there are 30 lines in this hotline. 30 line call center is managed by the Department of Consular Affairs. You see that on the last line below. Thailand's entry scheme, Department of Consular Affairs, and you have the hotline there. The In addition, please allow also a couple of days for any email inquiries to be processed. So I'll just leave that a little bit on screen for you to see. Now, turning to the general situation within the country. Currently, we now rank 30th in the world for the number of COVID cases, which is an improvement from the past few weeks and months, when at that time we were ranked in the mid-20s. So now we're around 30. We have recorded some higher number of cases in the past few days. New confirmed case we have recorded since for today is 10,470. We have active cases at the moment, 92,784. While new recoveries, quite high number of new recoveries, but for today not as high as the new cases. New recoveries is 8,711. And new fatalities remain still to be low at 12 recorded for today. So of the 12 fatalities today, we have 9 cases, so the majority being the elderly, and 3 cases are those who have congenital diseases. All fatalities are from vulnerable groups, and the CCSA continues to advocate and to prioritize vaccination for these groups. Moving on screen now, you can see the top 10 provinces with COVID-19 cases in Thailand. In green, of course, it means less than the previous day, and in red, it means numbers which are higher than the previous day. I think we have a tie around half of that, half are green, half are red. Now, good to see that the capital city, big cities, Bangkok, Chonburi, for example, are having a less number of cases recorded than the previous day. And for vaccination, yesterday we administered 216,538 doses of vaccines, making the accumulated total for the whole country since the beginning of vaccinations to be more than 117 million doses now. Now this brings us to 75.5% or 52.5 million people of the population who have received their first dose. And we have 70.4% or almost over 49 million people who have received their second dose. And for the booster dose, we're now at 22.5% or over 15.6 million people having received their third or booster dose. Now I'd like to move on to the vaccination sites that we have. We have 7 vaccination sites outside of hospitals in Bangkok for all nationalities and, of course, aged 18 years and above. For the vaccination site, I'll just give some. Vaccination site at Central World in Bangkok. You can use the QR code on screen right now to make an appointment or visit the website. I'll leave that on a few seconds. You can find this infographic in the Public Relations Department page. The website to make an appointment is vaccinecenter.kcmh.or.th. And you can find this information, this infographic, online. For the other vaccination sites, such as at Thai PBS, Tanya Park, Central Rama 3, Central Pinklau, and others, please register via the QEQ application. So just to stress the importance of staying vigilant and strictly following the universal prevention for COVID-19, the Ministry of Public Health had reported earlier that about 10 to 20% of all COVID patients in Thailand are suffering a post-syndrome condition. This is also known as the long COVID symptoms after their recovery. Now, this is very important because after one had been positive with COVID and recovered or cured already, this is something that many people in Thailand have been suffering from, post-COVID syndrome or long COVID symptoms. Of course, we come to you with daily numbers and the daily situation, but looking in the longer term, to see those who have been affected in the longer term in the process of their recovery is also very important. It's also something that we've been looking into all through this time. So long COVID displays symptoms of fatigue, muscle pain, headache, and depression. These may occur from the body's reactions or side effects of drugs administered to the patients during treatment, and some conditions linger beyond the period of treatment. Age, obesity, and daily steroid use are among the factors that increase the prevalence of long COVID symptoms. According to statistics, the symptoms will take about 6 months to a year to recover from. This is for long COVID symptoms, depending on each person. And these symptoms may be alleviated by the use of vaccines. People who have received the COVID-19 vaccine have less chance of contracting long COVID symptoms, as the vaccine provides protection against this condition. So I've been receiving some suggestions as well that we have to look in the longer term. Of course, we've been doing that in every briefing of ours. We look in the longer term. We look into the long-term effects of the various of the symptoms. We look into the psychological effect, the mental health effect. As you can see, sometimes we talk about the trend in the future, and we'll come with that information from time to time. The trend in the future. It's been a long 2 years, but our fight still continues, and hopefully that the trend will be getting better in the days ahead. We'll focus on the trends of the future as well. So lastly, just before I end, I'd just like to say that we'll be having the General CCSA meeting this Friday, the 11th of February 2022, and the briefing would most probably be on that day. So we hope that from this General CCSA meeting this Friday, we'll be reassessing the situation up until now, up until February, and any relaxation or tightening of measures that we have to put in place. Of course, as I mentioned before, oftentimes in crisis like this, we have to be very adept to change. Change is sometimes part of the plan, and readjusting policy according to the situation is something very, very important. It would be remiss and not very good of our duties here at the CCSA and in the Royal Thai government to not adjust and change according to the situation and, of course, the various challenges and threats that COVID-19 has put upon us in the various years, in the past two years. So we do all of this in good faith. We do all of this for the health, for the protection, and for the well-being of the people of Thailand and all of our foreign friends and residents here in Thailand. So with that note, I thank you for your attention in the past very long time. We hope that we can fight off COVID. Our determination still continues. Our resolve still continues. Thank you for your attention. With that note, I'll see you again on Friday. สวัสดีครับ
ครับขอบคุณนะครับ